Good morning. Welcome to the LeadingAge Virginia Coronavirus Weekly Member Update. I'd like to hand it over to Melissa Andrews to begin the call.
Thank you, Dana. Well, a happy new year to all of you, and thank you for joining the call this morning. Dana asked me to kick it off just to share a couple of reflections. And so for those of you who were on the LeadingAge National call on Monday of this week, you would have heard the Surgeon General speak about the vaccine, his kind of predictions, or if he had the magic 8 ball, or the crystal ball, what he's seeing. And he gave a lot of hope, and he also gave a lot of reality. And I think that, the announcement of the vaccine gave all of us hope, and seeing your photos being posted on social media as you and your team members and your residents receive the vaccine certainly continue to drive that hope. But the reality is that we're still in this, and we are still remaining diligent. And so, I think, excuse me, I think back to what everybody must have been thinking when they woke up on January 1st, 2020, which was a new year, a new day. And this year was a little bit different. We woke up on January 1st of 2021 and thought, new year, new Groundhog Day, because a lot of it is still the same as it was, before. But I'm just thrilled to say that thanks to our continued partnership with the Department of Health and all of the agencies, both at the state level and the federal level, we continue to be in all of the conversations so that we can support you in the best way that we can during this vaccine rollout, and with continued education for those who may be not interested in the vaccine the first time around, but hopefully through continued education will be interested when those clinics come back to you, or when the vaccines are implemented more broadly in the Commonwealth. So I just wanted to say thank you for your continued just diligence, your hard work, your attention to the mission. And I'll leave you with, and some of you might think this is a little hokey, but I was speaking to a dear friend and colleague who I know is on this call the other day, and we discovered that we had a common love for Winnie the Pooh. And I don't know if any of you know, but Winnie the Pooh is one of the wisest characters that have ever lived. And if you doubt me, you can look up a book called The Tao of Pooh. But what makes Pooh so wise is his simplicity. And so as you go through the next couple of months, I just want to remind you that you are braver than you believe, stronger than you seem, and smarter than you think. And with that, I will appreciate your comments in the chat that nobody could get any hokier on a call about a vaccine, but I really believe that about our membership. So thank you for all you're doing, and know we're here for you for whatever you need. Dana?
Thank you, Melissa, for those positive words. And thank you, Mike Magner with the Department of Health, for joining us today to provide a CDC pharmacy partnership for the long-term care program update. So over to you, Mike.
Hey, good morning. Thank you, Dana, and thank you, Melissa. So the big news for this week, of course, I'm presenting on the long-term care pharmacy partnership program. That's, a federal contract from CDC through CVS and Walgreens. Each state had different decision points that they had to make based on the allocations of vaccine they got and the populations of their long-term care facilities in their state. So Virginia, based on our vaccine allocations, we activated Part A pretty early on December 14th. Initially, there was a 2-week waiting period between when you activated and when the clinics could start, so that would give CVS and Walgreens time to contact all the facilities and begin scheduling. So the first dates of clinics were December 28th, as of yesterday, 66 facilities have been completed. I just checked the data on Tiberius just now. We're up to total of 70 facilities completed. And as of yesterday, 8,812 doses had been administered in skilled nursing facilities in Virginia. And 248 of our skilled nursing facilities had been scheduled for their first visit, with 46 still pending scheduling. And I think there's even more scheduled now, so I'll have to go back and check the data. The other big news, of course, is that Part B, which covers the assisted living facilities and others, and we talked about others. There's, residential group homes. There's, ICF, IDDs, and a few other types, CCRCs, and some other types of facilities. Are all included in that same group, ALF and other. And that was activated on December 31st officially. However, instead of having to wait a full 2 weeks, we were actually given permission to start vaccinating that group on January 11th. And so I know based on the Tiberius data that most of the ALFs and others have not been contacted yet by CVS or Walgreens. I know they're still primarily focused on the skilled nursing facilities. They do have the ability now to start contacting those facilities and start scheduling events. So if you haven't been contacted yet, you're probably not alone, and it's probably not something you've done wrong or that we've done wrong. It's just that they are working to get all of the skilled nursing facilities prioritized, and then they'll go to the others and start scheduling those events. However, now that they have both Part A and Part B activated, they do have flexibility to schedule, those facilities that have, multiple types of facilities on the same campus, such as a skilled nursing facility and assisted living facility. They can actually now schedule them both for the same day if that's what's desired by the facility. Now, some facilities may still want separate visits for both facilities. And again, that's something they'll have to work out with CVS or Walgreens. So that's pretty much it. I think, one of the biggest learning experience in this is that even though we could start vaccinating on December 28th, there was an assumption kind of that all the facilities would get their vaccine on that day or that week. And, there are a lot of facilities in Virginia, and even though, the workload, both CVS and Walgreens are breaking up the workload regionally among their different, sub-facilities that they have to work through, it's still going to take some time. I think it's going to take probably into March before all of the facilities in Virginia have had 3 visits from CVS or Walgreens. And that's pretty much it. I'm available to take some questions. I didn't know if you want to take questions now or wait till the end.
No, I think this is a great time. You can put your questions in the chat box, and while we're waiting for some of those, I wondered, Mike, if you could clarify if you are a continuing care retirement community, as we discussed earlier on the call, and you, of course, have all 3 levels, nursing home, assisted living, and independent living, but you have not heard from Walgreens or CVS, that is because the CCRC may have been designated in the other category. Could you comment on that?
Yeah, and I think, there's different ways that different states license, retirement homes and nursing homes and assisted living, within their states. And so, you have some data crunchers at CDC that are taking all of these enrollments through NHSN or through the REDCap survey and trying to match up facilities with their category type. And so I think, unless it said skilled nursing facility in the title or somewhere in the registration process, it got lumped into that other. So that's, a little bit unfortunate. If it was a skilled nursing, it wasn't flagged correctly. Unfortunately, it was stuck in the other. So I can alert our CVS and Walgreens staff to prioritize those groups higher. But this is something I just became aware of today.
Okay, thank you. So to clarify, if a continuing care retirement community has not been contacted, do we need to reach out to you to determine if they are in the other category?
I mean,
Or
I
should
can
they
tell you
assume?
looking at
Mhm.
I can tell you looking at the list that they were put in the other category.
Okay, great. Thank you. Melissa, are there any questions in the chat box?
They're all the same. They're all about when will we be able to vaccinate the independent living population in a continuing care retirement community population on that campus. Every single question we've gotten is asking that.
So Mike and I had some email discussion about this earlier. please comment, Mike, about your thoughts about when independent living may be available. There are some communities that were able to work this out with their representatives to include independent living if there were enough doses that were brought to the community, but it's been a community by community situation. Did you have anything to offer on that, Mike?
Yeah, this is the first time I'm hearing that individual facilities are being told there's just not enough vaccine to cover their facility. Now, I do know that early on when we had, mixed facilities on the same campus where they had a skilled nursing facility and also an assisted living or an independent living on the same campus, and, before we activated Part B, they could only vaccinate the skilled nursing facility and would have to come back later when Part B was activated. So after January 11th, they should have enough vaccine supplied to vaccinate multiple facilities on the same campus. But before January 11th, they were only able, up till January 11th, they're only able to vaccinate the skilled nursing facilities because that's based on the vaccine supply that was allocated and provided to them.
So if I'm hearing what you're saying, Mike, to the folks have been wondering that because the next phase is activated as of January 11th, which we are not at January 11th yet, that when they hear from their pharmacies, it will be that they will be vaccinating the rest of their campus population, right?
Correct. So they'll have to schedule another visit to come back. And that's assuming that the rest of the campus population was registered as well as the skilled nursing facility. So that's just something also to make sure to verify. But for most of them, they're both registered. It's just a matter of it's not a January 11th yet. So even though we've activated the program and the vaccine has been allocated, it hasn't arrived yet.
Yeah, and so I'm seeing some more questions come up where, yes, it is true. There are some communities who have gotten everybody vaccinated. And so to reiterate what Dana said, there have been situations where the pharmacy has worked directly with the provider to say, how many do you need for your whole campus? And okay, we have that and we will bring that. It has been really inconsistent. So for the but I am concerned, Mike, there's a member in the chat who says that they have, let's see, they have not been contacted about a date for their nursing home or their assisted living. So what should they do? Should they reach out to us and we can follow up with you, or what's the process?
Yeah, I'd have to know the details of the specific facility, make sure that they were, enrolled in the program and that they were enrolled correctly, and then figure out which pharmacy it is that they're assigned to. And then, I understand that for all the skilled nursing facilities that were enrolled, Walgreens and CVS have made at least the initial contact. Now, there were that list of about 10 skilled nursing facilities that were erroneously excluded and just accepted by Walgreens and CVS on the 29th of December. And I'm not sure if all of those have had a chance to be contacted yet, but both of them are supposed to be giving me an answer on that soon.
Okay, so I'm going to ask. So Lori, if you could just email Dana or I'll put our emails in the chat, and we'll get back with Mike around your challenge. There's a comment. My CVS representative told me that our independent living residents should contact the local health department or their primary care physician, as CVS will not be providing to IL residents of our CCRC. Can you comment on that, Mike?
Yeah, I'm not sure about the facility and how they're registered and what numbers they reported. I'd have to look at that specific case.
Okay. So as I'm reading your comments and you're hearing that we need specifics from you, if I've put my email and Dana's email in the chat box, just email us both and we'll dog these issues for you. Paula, I think you just heard from Mike that that the pharmacies are committed to vaccinating independent living during this next phase. So if your pharmacy is is not communicating that with you, just follow up with Dana and I offline. I think that Mike, what I'm hearing from you is that because things are changing as of January 11th, the information people had prior to today is probably different from what they're going to get from today on, based on that announcement yesterday. Is that a fair statement?
Yeah, that's a fair statement, and I do need to check on independent living because, again, I think it depends on the facility itself. So if that facility was registered that way to include those numbers, then that answer is true. Now, if they only registered the skilled nursing facility and the assisted living facility part of the facility, and the IL part is not included in those numbers, that may still be true. So that's something, again, where I'd have to look at, what's the facility and how were they registered.
So what I'm seeing in the chat is that they did report all of their numbers for the entire campus as, recommended. So I'm just going to just say again, for those of you who are putting in the chat that you have not been contacted, or that your CVS representative is saying they're not going to vaccinate IL, please email Dana and I with the specifics, and we'll get with Mike and we'll figure out what's going on with each of your communities. If you have not been contacted at all, you fall into that category as well. So our email addresses are in the chat box. So as you're listening to this, go ahead and fire off something to us, because it's, again, this has been a really, the rollout of this has been very distinct from community to community. We have not seen total consistency across the board, just based on relationships with pharmacies and different other dynamics. So I'm not surprised that you all are experiencing this, but if I'm hearing Mike correctly, which I know I'm pretty sure I am, is that there are solutions. So we will figure it out, but it really is based on your specific organization and how you reported your numbers. I see there's a comment, our independent living was not included, but the pharmacy has some left over, and we were set up a high-risk list of ILs, and they were able to get vaccines yesterday. We have many more that were not included from independent living. Mike, this came up on a call yesterday, and with regards to the pharmacy showing up with more that was allocated, and it was a small provider who said, we didn't know who else to vaccinate. And my response to providers has been anybody who's walking by you, just because we don't want these vaccines to go to waste. So what is your official response if they've thought of, and everybody who was supposed to get vaccinated that day has gotten vaccinated, but there are people who want it who don't necessarily fall into that category? Kind of what's your guidance for communities?
Yeah, so the guidance is we don't want to waste any vaccine. I think that's a good best practice to have a list of, high-risk priority people that maybe weren't included on the original list but can be there on standby. And I do want to also reiterate something, that the program that CDC set up was primarily for skilled nursing facilities and assisted living facilities, and they did allow some what we call others to sign up. But if we truly included all other facilities, whether it's independent living or group homes and other things, there'd be thousands of these facilities they'd have to add, and there'd be no way the program would be effective enough to cover all of them. So it is, ultimately it's the state's responsibility to protect its citizens, and CDC did help out with this pharmacy program. If we do have facilities that were not included in this, that doesn't mean they can't get vaccine. It just means that we're not going to be able to do it through this program. So, that's something that we're working with at the state level, how to get the other facilities that weren't included. Right now, the answer is to work with the local health district. We know that the local health districts right now are slammed and are trying to just vaccinate, groups like EMS and first responders, and the number of people in that phase 1A that they're expected to vaccinate is huge. So we are looking at other pharmacy solutions and other partnerships, but we just don't have a great answer. So just because they're not included in this program doesn't mean we don't care about that group and we don't want to vaccinate them. It's just trying to figure out how to do it.
Right. Yeah, I appreciate that, Mike. And I just want to reiterate, I mean, that's the message that we're hearing from the Surgeon General. I mean, the goal is to get every single American that wants to be vaccinated, with prioritizing, the most vulnerable among us. So, I don't think we can be more clear. Do not let the pharmacy thaw vaccines and walk out off of your campus without having used them. That doesn't benefit anybody. So I think, Desi, your suggestion around, you had that high risk list from IL. I know a provider in a different state who some of their independent living residents have spouses in the nursing home. So when the pharmacy had 15 extra vaccines that had been thawed that they needed to use, they grabbed those IL residents who have spouses in the nursing home so they could be on the same timeline and trajectory. So there's no there's nothing wrong, Mike, just to reiterate, because we've heard this from members. There's nothing wrong with using every vaccine that's been thawed that the pharmacy has given, right?
That is correct.
Okay. There's no vaccine prison that anybody's going to go to.
Or vaccine police.
Right.
And Mike, just after all that was said regarding independent living, I did want to confirm with you that if you are an assisted living and you have not heard from the pharmacy, those communications will begin on January 11th. Is that correct?
Almost. The vaccination clinics cannot start before January 11th for those facilities, but they should be contacting these facilities already. But again, they're going to try and schedule all their skilled nursing facilities before they begin contacting assisted living. So I don't have an exact date as to when, a given facility might get contacted in the next few days or weeks.
Mike, another question has come in, and this is on the affordable housing side. So for HUD properties, there's concern about creating a priority list as it may violate fair housing. But are we going to see vaccine distribution at congregate settings like a affordable housing provider, or is there going to be a different way to disseminate the vaccine to those older adults?
Yeah, as far as I know, we have a small number of HUD properties that are registered for the program. And I think, let me just check real quick. And we've got about 28. I'm not sure exactly how they're prioritizing. My assumption is that if they're on the list and they've given a certain number of residents, that they're going to come out and provide vaccine to all of the residents they tell them to.
Okay. Michael, I see your comment. Is that your retail rep or is it your coordinator for the vaccination? Because they could be different people. So it wouldn't surprise me if your Walgreens retail rep was unaware that ALs would begin on January 11th. That announcement just came out yesterday. So, Mike, it's literally hot off the press. So it was the coordinator for the vaccination, and it was this morning. Yeah, you might want to send them the DSS memo that Dana just posted, because it could just be because they're so. There's something, a breakdown in communication somewhere, Michael. But if you need us to follow up, we'd be happy to do that. But I don't know that Mike, that you can comment on a Walgreens rep not knowing that the green light was given to AL yesterday, or to begin scheduling as of the 11th.
Yeah, my guess it's just a communication breakdown. I have let Walgreens know at the state level, so we have a state POC that I talk to several times a week, and I let her know on December 31st. But if the information just hasn't disseminated down to individual stores, I can let her know and see if she can work it on her end.
Thank you. Hey, wow. I'm just making sure I didn't miss anything. I think that's all the questions until somebody else types something in there. So I'm gonna stop talking, Mike, and turn it back to you.
Well, thank you, Mike. We really appreciate the update. We hope that you can remain on the call as we enter into our member discussion about the experiences so far across our membership. Unfortunately, one of our members who was going to speak today has had an emergency at her community, so she'll be unable to speak. But I would like to hand it over to Josh Bagley with Goodwin House, and then also encourage others who've had experiences with clinics at their communities to offer comments following Josh's presentation. So over to you, Josh.
Thanks, Dana. Echoing Melissa's sentiments about Winnie the Pooh, give everybody a happy Wednesday. Just in follow-up to our conversation a few minutes ago, I texted our vaccine coordinator at CVS and said, hey, I heard today that assisted living facilities can now get vaccinated after January 11th. Can I schedule a call with you to get something set up or perhaps add on to our next clinic? And he said, I'm waiting on an assignment from corporate. Once I get that communication, I will let you know. I guess as a provider, this whole process, I've felt completely out of control, very excited and anxious about the vaccine, but completely out of control. It was the communication was a little bit frustrating with CVS because I didn't hear until 2:00 the day before they were coming about even the number of vaccines they were bringing. So, I'm hopeful. I think they called us a pilot. So I'm hopeful our experience, which I'm very grateful we were able to get the vaccine, will help inform both CVS and, as well as all the providers on the call today about how to make this process cleaner and better. We turned in a number of 240 for our skilled nursing as a number of vaccines we wanted, and 450 for our independent living and assisted living areas at our Lifetime community at Goodwin House Alexandria. When I got a call from CVS, they said, we're going to bring 187 vaccines. And I said, no, that's not the number I asked for. We need 240 for our skilled nursing. And then I said, will you please bring more? And try to talk them up as high as we could go. They said, we'll bring 300. And I guess the punchline of our vaccination day is because of our efficiencies and our planning and our collaboration with CVS, we were able to vaccinate 375 people when the original number they provided to us was 187. And they mentioned that was some type of allocation, like they took 240 and they times it by 75% or something like that, because they're finding at other communities early on, people were saying no and they had a vaccine that was going to waste, and I assured them we would not waste any. So I just wanted to maybe give everybody some gold nuggets for how to prepare for the vaccinators coming to the community. There were a lot of things that they were grateful that we did, a lot of things that the staff were grateful that we did, and some things we could do better. So I'll just kind of punch through some bolded items that I've outlined as hopefully some gold nuggets that you can take away as you plan your clinics. The vaccinators told us they could handle about 10 people per pharmacist that was vaccinating. We were able to milk about 15 per hour per pharmacist. We had 2 pharmacists doing staff. We had 2 pharmacists doing residents the entire day. They arrived about an hour before. They were 11 o'clock, so they arrived at 10 o'clock to get set up. It took them about an hour to get set up. They had computer issues. We were on standby to help them with Wi-Fi. That was no issue for them. But they worked it out and we got going. We had a copy machine set up at our check-in desk, which is really helpful because we were able to make copies of insurance cards that we had somehow missed or that got misplaced. We had 3 different rooms that we assigned for the vaccination process. We had a waiting room, we had a vaccination room, and we had a recovery room. And this was really helpful in our flow. It kind of felt like the DMV a little bit. We gave color-coded assignments and color-coded numbers to people as they were coming in. So, as they checked in, they got number 1 through 20, and we called 10 numbers at a time to go and wait in line. So they left the waiting room and went and stood outside of the vaccination room. And that was the vaccinators were grateful to have management of the flow. So they had a constant flow, but nobody was pushing in and overwhelming them. We were also able to escort a few staff members that were doing double shifts right to the front of the line. They got a fast pass. We had space set up how they wanted it in the grid, but ended up adding about 4 more tables when they came. They need 2 tables for the registration desk, and they needed another table for their stuff to be stored, and then they needed another table for the vaccinator. They have one pharmacist that's assigned to fill all the syringes and to thaw the vaccine throughout the day. So they sat there for about 8 hours just pulling vial after vial. We decided to have a wait list for the vaccine as well. The people that were showing up throughout the day or didn't turn in their consent form in time. We saved the last half hour to hour as open slots that we were able to put people on a wait list. And then we also assigned somebody in human resources to manage the wait list, so the people at the screening desk didn't have to do that. So we just said contact so-and-so, contact so-and-so. And that was really helpful, so it didn't clog up the vaccination process. What did we do for the vaccinators to make it easy on them? We filled out everyone's proof of vaccination card for them. We got them lunch and water throughout the day. We had Wi-Fi available for them as they showed up. They do bring a MiFi, but a lot of them, they got all their computers on our Wi-Fi at the end. We took temperatures of our staff and residents for them before they administered the vaccine. And they really appreciated, again, that flow of coming into the test space. I think one of the best things we did is we had a schedule for staff members when they could come, scheduled blocks. And we used an online Excel tracking tool that allowed for 5 of us to be in a live document, and we all knew what was going on. 2 of us were checking people in. 1 person was managing the wait list and adding on to it. And then 1 or 2 people were calling those who didn't show up for their appointments to figure out what was going on. So it was really helpful. And then at the end of the day, I had an immediate total number of people that were vaccinated, because the CVS asked us for that number before they left. For the residents, we had all of their paperwork ready in order by room number. We had the residents by area. They were sitting outside of their rooms, either in a wheelchair or a chair. This allowed us just to go very efficiently to give everyone the vaccine, but more importantly, allowed us to do a 15-minute observation in the safest way without having to walk in and out of every resident room every 2 minutes to make sure that nobody was having an adverse reaction. And of course, we encourage our residents to wear sleeves that allowed them to get the vaccine easily. The consent form process was very monotonous. I think one of my biggest takeaways was, even though corporate was communicating over and over, use the triplicate forms, and we had to wait till like 4 days before the vaccine to get triplicate forms. The actual team that was on site didn't care if it was the triplicate form or the paper form. I honestly prefer the PDF forms because you're only dealing with 3 papers rather than 6 pieces of paper. So don't stress too much about that. Again, I'm talking about CVS and my experience. We used our regular testing schedule to obtain consent forms from the staff, and that allowed us to do a lot of one-on-one education for people who didn't want to fill out the form. We're doing that again tomorrow for our second consent process, and trying to get those others who didn't get the first vaccine to sign up. So that was a really big win. At the end of the day, we're able to vaccinate 67% of our nursing staff. And a handful of them were pregnant, a handful of them, were quarantined, and another handful didn't want it. So we're hoping to increase that number to 90% in coming months. At the end, we kind of had a mess separating out all the consent forms. So encourage you, when they come on site, to talk with the team leader about how do you want us to handle the vaccine, the consent forms. We hope to be able to separate them at the check-in table that we're managing rather than having to do it at the very end, because there was about 6 of us just pulling apart everybody's consent forms, stapling and restapling. It was a mess. Again, this is way too much into the details, but I'm very detail oriented. We had the consent forms and the insurance card on the bottom because they want to walk away with one consent form and one insurance card. So I know that's a little into the weeds, but as you're putting your things together, it'll save your team a lot of time on the really difficult day to have that consent form and insurance card on the bottom, and you can give those bottom 2 to them if you're not using the triplicate versions. And just some other really small tips. We prioritized after our because we're able to increase the number of people vaccinated because of our efficiencies and not quite begging, but almost begging them to bring as many vaccines as possible. We were able to do the majority of our healthcare center residents and assisted living residents. And we also prioritized independent living spouses that have loved ones in higher levels of living. And that was a really big win. And then just final tip, we had assigned roles for people for the entire day, which was really helpful. We had our supervisor and ADON assigned to be with the vaccinators, taking care of the residents. We had an administrative assistant who was support for them in any admin stuff they needed. Our trainer was doing line management, the vaccinator room logistics, getting lunch for the vaccinators, social distancing police. HR director was managing the wait list and late consent forms. 2 from HR and myself were on the check-in team. And I was the runner that was going back and forth, constantly communicating with the vaccinator team lead about how many vaccines do we have left and how many people do we have left, how much time do we have left, how many more can we fit in. She was a joy to work with. We had a nurse monitoring the waiting room or the recovery room looking for adverse reactions, and our DON was in the vaccinator room coordinating traffic and answering billing questions that were being fired left and right throughout the day. So really detailed. Sorry, everybody, but hopefully those of you who haven't had the clinic yet got some gold nuggets, and happy to answer any questions that anybody has. It's at the end of the day, I just can't tell you how much energy and how exciting it was because we built such a good atmosphere. A lot more staff got the vaccine that were teetering on the edge because of the peer pressure and the excitement and the short wait. So hopefully some of these things can help you all vaccinate more people and save more lives.
Hey, Josh, a couple of questions. One, thank you from us, but there's a big thank you in all caps in the chat box, and definitely not too in the weeds. I think everybody's wanting those details, so it'll help inform their processes. Did CVS send you the blank forms, or did you have to print them yourselves? Lisa was told going to receive the triplicate copies, but haven't received.
They sent us 100.
They sent you 100.
And yeah, not very many. Maybe 120. It wasn't very many. Not enough to barely cover our healthcare residents and assisted living residents, and definitely not enough to even cover all the staff we requested in the original number.
And then my question is, did they say you need to have consent forms for the second round? Or will the first round still stand?
We need to repeat consent forms for the whole second process. The only thing that they really care about in those consent forms is for the billing process. Mm-hmm. They want the name, the address, the phone number, and the insurance ID, and the address in some cases. But I guess CVS isn't on this call, so I can say I was a little frustrated because I spent so much time preparing the upload into CVS's website, and they don't send that information to the vaccinators. The vaccinators have to put everything in again. So I'm hopeful that they fix that in the future so we can speed this process up. They told us it will go faster the second time because everyone that got the first dose, their information is already in the system. But we could have vaccinated 200 more people if they had the vaccine and if we weren't held up by the billing process. Mm-hmm. They brought in 2 people later in the day just to help with billing, and at 5 o'clock they had assigned another pharmacist to the billing. So they had 5 people doing billing, for half of the time, and 2 or 3 people doing it for the entire time. So
Yeah, I have heard from other members it's not consistent how many pharmacists they're going to show up or how many, like just how many people. It differs from campus to campus.
yeah, they brought 2 students with them, which was helpful. And I don't know, when I talked to the pharmacist lead the day before and I was milking up the numbers, he said, "Oh yeah, I'll add one more pharmacist to the team tomorrow." And I don't know how he can just pull a pharmacist out of the air 12 hours in advance, but he did. So yeah.
It's magic. It's magic. Do staff have to bring their oh, I'm sorry. They're coming in so quickly. I have to move the chat box. Do staff have to bring their insurance cards or just have the information filled out in the form?
They need their insurance cards. They're stickler about that. I think they turned to the insurance card page on a lot of the people because handwriting isn't always legible. But they turned people away from getting the vaccine, and they had to go to their cars and get their insurance card and come back. So after they turned 1 or 2 people away at the desk, we at their desk, we had our own check-in desk. We made sure that everybody had that before they went back. And please make 2 copies now rather than later of everyone's insurance cards, so you don't have to gather them again, because that process is terrible. So run everybody's through again and make sure you get them again. And same with the residents. We went into our electronic health record and printed everything once, and we should have done it twice for the insurance cards, and we didn't think about it. And we did ask if they need the insurance cards on their second round, and they said no, as long as it's on the consent form. However, I just, better safe than sorry. I'm an over planner, and we want to make sure we make it efficient for them.
So I'm seeing in the chat that, and just a reminder to everybody, Josh's experience was with CVS. So for those of you who have had Walgreens, I'm seeing in the chat that they were not concerned with the insurance card or specifics. So I don't know if anybody has had a different experience with Walgreens, please put that in the chat so we know. But it sounds like Walgreens is not requiring the cards. Josh, did you go ahead and make 6 copies of the completed consent, so you would have 3 copies for the first shot and 3 for the second, so you wouldn't have to do it again?
No, and I'm glad we didn't, because at CVS they updated the consent form last week.
Okay.
And also, really helpful, in case everyone hasn't found out, if you go onto the CVS website, they updated it over the weekend. You can now confirm your clinic online, and they gave you a phone number to call, because that was part that was really, I had to call Melissa because I was so stressed. The Friday before my clinic was Tuesday, and it was Christmas Eve, and I'm like, next day is Christmas, and then the clinic is next Tuesday, and I have no idea if they're coming. They haven't even given us a confirmation email. So I've somehow found a phone number to call and waited on 45 minutes to get my clinic confirmed on Christmas Eve. But I'm just grateful that they have an online and phone number available for everybody to get that confirmation email, so you can do the upload.
Yeah, and so Mike Magner, are you still on the phone?
Yeah, I'm still here.
Okay, so just a couple of things. One, I just want to publicly thank Mike. So Mike was, kind of supposed to be taking some time off, and he got on the phone with Josh and myself and Dana and his colleagues that night. So I just want to publicly say thank you, Mike, for your willingness to just get on the phone at any time to help our members through this. But my follow-up to that is, not to put you on the spot, but we heard on Monday that CVS is going to set up office hours where providers can call in at a certain time. They hope to have it stood up by today. We haven't heard word. I don't know if you have, but I also saw that North Carolina, their Department of Health was setting up a call-in number for people with questions about the vaccination. I think that's more for the general public, but I was just curious, are we going in that direction in Virginia, or what's the best route? Especially because, you know, we get inquiries from families, our members do, around what their vaccination is going to look like and all of that. So what's the best way for people to get the latest information?
Hey, that's a good question. I don't have a specific call-in number. We do have, you know, through the state, we've got our basic, I think, vaccination helpline, and I don't have the data with me right now to put that out. And I know both CVS and Walgreens have their website, and they've got their 1-800 numbers that you can dial. But as far as some kind of formal, like, office hours or that kind of thing, I haven't heard that yet. You know, that's something that maybe we can take back. I mean, typically we've just been, you know, handling individual questions as they come up.
Okay. All right. Thank you. Josh, fabulous. Is there anything else that you wanted to add before I call out a couple people to ask them something?
I just Claudia Blake's email about making 6 copies versus 3. You know, the new form has, you know, a space to designate whether it's a first dose or a second dose. Also, there's a question on there. It says, like, "Are you sick today?" And there's a space at the top that says the clinic ID, which Clinic 1 has a different ID number than Clinic 2. And again, I don't know how much these details really matter to the vaccinators, but that they are different. There is different information on each consent form between the different clinics, but we are just making copies of the family member abbreviated consent forms, as those don't have those such details, so we don't have to ask them for 2 different forms.
Okay, so that's really important that everybody heard that. You can't just in advance duplicate those forms since they're different forms. So Josh, thank you so much for being willing to share your experiences, the good, the bad, the ugly. I know everybody benefited from that. And I guess one more question, Josh, what did you say was your percentage of staff who agreed to get the consent? I mean, who agreed to get the vaccination that were eligible that day?
In our nursing specific, it was 67%. You know, the entire campus, the entire life plan community, we've been able to vaccinate 50% of our staff now.
Okay.
And we're hopeful to be able to, you know, that was because of a limit of dose, the limit of vaccines too. So.
Yeah, and that's what we're hearing. We're hearing on average 50% of staff are saying yes to that first clinic. So we hope that the power of seeing that everybody's okay after that first clinic will incentivize them to get vaccinated. So thank you so much. I just wanted to ask, I know they're on the call and people love when we call them out. Dana, is it okay if I call somebody out, or did you have something else?
Before you do that, I just wanted to ask Paula if she could move to the next slide. I just wanted to make sure everybody knew that we have a webinar coming up tomorrow that you can incentivize your staff to have them get on with Dr. Jim Wright to ask questions about the vaccine. So just contact Paula if you need the information. So the information is also up on our PowerPoint. But yes, please call.
Well, so I know David Abraham and Rebecca Morales are on this call only because their names are listed. But David, you and I were on a call yesterday, and you mentioned that you had some lessons learned from your team with your clinic. And I was just wondering if you or Rebecca would be willing to share that with the group as well.
Yeah, I think. Can you hear me okay?
Yes, thank you.
Thanks, Melissa. I think Rebecca stepped out of her office, but you know, all in all, I thought our day went very well. We had a meeting yesterday just to talk about the pros and the cons and what we can do better for the second vaccination clinic. Much like we heard, though, you know, when we onboarded with Omnicare and CVS, we were under the impression we were going to do both our AL and our SNP at the same time. Only to learn 3 days prior that we were not going to be able to do our AL, only to learn when they got here and they brought extra vaccines, we were able to do our AL. So much like you heard on the call and in the chat boxes, where we didn't want any vaccines to go bad, we were able to do our entire campus. We were able to onboard some of our private duty sitters, some of our folks with our home health agency, some of the folks with our hospice agency. So all in all, we were very pleased with how it turned out.
And David, were there any surprises that people should be prepared for in terms of when the team shows up from your perspective, or anything like that?
Yeah, I mean, I think as it was mentioned, I don't know why all of the information is sent to CVS in advance because, again, there was a lot of slow up in the giddy up, and Rebecca just walked in. There was a lot of slow up with what was being entered into the system, and employees were backing up. Rebecca, you're on the call. Do you want to add anything into the form, into how the vaccination clinic went?
Oh, I think it was just a little bit slow, but overall it was it went really well. Just the slowness of it. You do need to upload all of your information to their system in order for it to go a lot better, so they don't have to do all of the information whenever they get here. That will help with the flow of the clinic itself. Just make sure you have a system where everybody will go once they receive the vaccine. Just have everything ready to roll. That way the staff, they don't get antsy. Have entertainment while they're there, just like music, goodies and things like that, just to keep people entertained while they're waiting for the 10 to 20 minutes that they recommend.
Awesome. Thank you. And thanks for being willing when I put you on the spot. Just wondering if there's anybody on the call who's had their clinic with Walgreens that has anything different to share for folks who will be partnering with them. If there's been any lessons learned or efficiencies that you found during your clinic, feel free to unmute and share with the group. Dana, that's all I've got. So I'll hand it back to you.
Thank you, Melissa. Well, we have finished up a little bit early, so I just want to give a last call for any questions for Josh or for Mike, or any questions or comments. Okay, I see one's come in, Melissa.
Yeah, so since CVS has just changed their consent forms, do we have to have staff redo the information from round one? It's Josh, correct me if I'm wrong, but what I heard you say is they redid their second consent form. Is that right? Oh, you're putting in the track.
Yeah,
Josh,
there's a new Q&A consent document that's like a 3-pager on CVS's website, but they say if you've already filled out your first one, no, you don't need to redo it.
awesome. Thank you.
And the CVS website is in the chat box, and I can put it in there again.
And Dana, just to confirm your exchange in the chat, that Thursday's webinar with Dr. Wright will be recorded, but we're encouraging as many staff to be there as possible so that they can get their direct questions answered live, right?
Yes, absolutely. And it's just going to be really helpful that once the webinar is recorded, if we have staff participation asking their questions, so that when we do provide the recording, that your team can see other staff members from around the state asking questions. So as many staff that can participate is really highly encouraged. Okay. Well, thank you all so much for being on with us today. I think this was a great call. Our next call is on January 13th, and I'm sure it will be a continued discussion regarding the vaccine clinics. So just stay tuned to your updates about information regarding that call. And I hope everyone has a great rest of their week.
And thanks, Mike and Josh and David and Rebecca for being willing to talk.
Yes, thank you so much.
You're welcome.